Hi, are you the super cool senior that organised my freshman orientation camp in 2019?
Yes, I organised the camp, but I'm really not that cool.
Can I ask you 20 questions about clinical attachments?
Yeah, go ahead.
Before we start, can we have a quick introduction?
Hi guys, I'm Shiyun and I'm a Year 2 NUS nursing student.
Alright, first up Shiyun, what's this you're wearing?
Oh, this uniform? This is actually my NUS nursing uniform and I wear this during all my clinical attachments.
Speaking about clinical attachments, didn't you just finish yours?
Yeah, I actually just finished mine at National University Hospital, NUH. All nursing students have to complete 1320 clinical hours before we can graduate as registered nurses.
So, how did you get to do your attachment at NUH?
Well, I'm bonded to NUH under the Ministry of Health Holdings Healthcare Merit Award Scholarship. So naturally, all my attachments will be at NUH.
Wow, that's very interesting. So what are the benefits of having a Healthcare Merit Award Scholarship?
All my school fees and my campus accommodations are paid for, and I receive monthly allowance during my study period. And upon graduation, I'll need to serve a 4-year board at NUH.
I have some friends who are not sponsored by Ministry of Health Holdings, but by public hospitals instead. So what's the difference?
Well, hospital sponsorships are provided directly by hospitals, so you need to apply for and work for these hospitals upon graduation. And the application period, benefits and bonds to serve vary across hospitals and are very different. And so that's why, remember to do your homework properly before you apply, as you have to live with your decision during the period of your bond.
So how were your clinicals, Shiyun?
Oh, it was really tiring, but very enriching as well. As nurses are still in demand, things are very busy in the ward and I'm constantly on the move.
Shiyun, could you show us some of the things our freshies will be doing during their first year clinicals attachments?
Yes, of course. So in first year, you do a lot of basic vital signs taking, such as blood pressure readings. And apart from taking BP, you also need to do nasal gastric tube feeding, or we call NGT feeding, and simple wound dressing. Come, let me show you how to do vitals.
Okay.
Wow, Marcus, your blood pressure is a little bit high. Why are you so nervous when I'm the one being interviewed?
Okay, next question. Shiyun, I've heard that there are postings to pediatrics, OB/GYN wards, operating theatre and even the accident and emergency departments. So are these postings for freshies as well?
So firstly, these are actually specialty areas, so no, they are not available for freshmen. However, you get to go to these wards in year 2 and 3 because by then you'll gain more advanced clinical knowledge and skills training.
Ah, I see. So after going through a few clinical attachments, you surely have some stories to share, right?
I actually have so many stories to share, but I'll share with you a recent one at my previous posting. So as you know, I have actually bad peripheral circulation, so my hands and feet, they turn cold very easily, especially with the frequent use of hand rubs in hospital and the cool weather nowadays. So I was actually taking BP for this patient and she felt my cold hands. And after that, she immediately took them into her hands and rubbed them together, helping me to warm my hands up. Context given is that most patients, they will flinch at our cold hands because like cold fingers don't feel nice on the skin, am I right? So, and it has been such a hectic day in the ward, so seeing the auntie do that for me, it really warmed my heart. And these small but kind gestures are really what keeps me going in the wards.
Oh my, that sounds really heartwarming, Shiyun. So what clinical attachments do Year 3 students have?
Well, in semester 2, Year 3 students have a whole semester of clinical postings, which we will call Transition to Practice, or T2P for short. So during these postings, we'll learn how to manage patients, just like a staff nurse, and most of us will actually choose to do our T2P at a department that we want to work in after graduation.
What do you do during this T2P period?
Well, T2P is really an attachment where we apply our clinical skills into application and learn how to manage different patients and prioritizing their needs. So you can see, T2P is actually very different from Year 1 and 2 clinical attachments because we take on the duties of a staff nurse working in the real world.
Wow, but isn't that a big leap, Shiyun?
Yes, it definitely is a big leap. However, we actually have clinical instructors, also known as CIs, to integrate us into our roles and consolidate our learning. Staff nurses are also very friendly and supportive resource to tap on despite their busyness. And during T2P, we're actually given our own preceptors in a 1:1 or 1:2 ratio. Some hospitals might even provide CIs during T2P as well.
Oh yeah, Shiyun, when you graduate, what kind of shifts do new nurses have to do at NUH?
I think the misconception is that nurses work every day. Actually, we don't. We have our rest days as well. except we don't do office job like 9 to 5, Mondays to Fridays, and rest on weekends instead. However, we actually do shift work that is split into 3 shifts, so morning, afternoon, and night. Now, morning shift stretches from 7 a.m. to 4 p.m, afternoon shift stretches from 1 to 10 p.m, and night shift stretches from 9 p.m. to 8 a.m. the next day. And our shifts are actually allocated to us based on the number of clinical hours we need to clear for that week. And our weekends can be any day of the week.
I see. So, Shiyun, I heard that nurses cannot have manicures, piercings, tattoos, or even dyed hair. Is this true?
Okay, firstly, we can't have manicures. However, we are allowed maximum one pair of ear studs and non-visible tattoos. And as for dyed hair, we can't have flashy colours.
So Shiyun, how do you cope if you get posted to a hospital that's really far away, such that you might not make it in time for the morning shift?
Well, you can actually ask your CI to report at a later timing. So for example, morning shift's reporting time is 7 a.m, so you can ask to report at 7:30 a.m. instead. However, this also means that you need to pay back by ending your shift 30 minutes later as well.
That sounds reasonable. So what do nursing students do after receiving their degrees?
There are alumni who choose to go into research, administration, policy making, pharmaceutical sales, startups and entrepreneurship, and even private settings. In other words, the sky's the limit.
Wow, looks like the nursing degree is indeed very, very versatile. So what about you, Shiyun? What do you want to do after getting your degree?
Well, I'm bonded to NUH, so I'll be working at NUH as a registered nurse after graduation. But I do hope to further my studies after I gain more clinical experience. And if possible, I'd like to become an APN, also known as Advanced Practice Nurse, and an educator when I'm older. There are really many pathways to take, and I like to take my time to decide.
Shiyun, I heard you are staying at the College of Alice and Peter Tan, also known as CAP. How has this benefited you?
Well, CAP has definitely given me a lot of friends from all walks of life and majors other than nursing. I've also taken 2 CAP modules during my stay there, and they involve exploring different groups of communities in Singapore. It has honestly been such a great learning experience, gaining exposure to different groups of communities, as we nurses have to interact with different people during work.
I see, that's very interesting. Fun question by the way, so how many school shirts do you have, Shiyun?
Oh, I think I have like 20. I have so many in my wardrobe that there was a period of time I was literally wearing school shirts every day, and my friends actually made fun of me for that.
Wow, you're such a loyal fan. Alright, last question for you. What's one advice you have for your juniors?
I think studies during school term may seem tedious and dry at times due to the sheer amount of theoretical content. But don't worry, because during clinicals, you see everything come to life and they'll make sense to you. And it's honestly so rewarding to feel that way. So hang in there and don't give up.
Thank you so much for sharing, Shiyun. I'm sure our freshmen know more about clinical attachments now. See you soon in school.
Okay, bye-bye!